from the health educators. Everybody has to come together. It's not just one particular segment of the health ecosystem. So security is very important. I'm glad to be here. I know it's going to be great. Welcome to Lagos, the Center of Excellence. Thank you.
Let's keep it up. Let's keep it up for the hearsay to the governor of Lagos State. I think there's something added to the Center of Excellence. I also heard land of aquatic splendor. I think I'm right. This is Lagos. You're welcome. Right, moving on. We'd like to receive the goodwill messages from the government representatives here present, talking about the federal level now. It is now my honor and privilege to receive to the microphone on behalf of the Federal Ministry of Health, representing the leadership, is no other person than the, than the Chief Consultant Epidemiologist for this country. Ladies and gentlemen, please make welcome Dr. Jamiu Ganiu. A round of applause for CCE, please. Apologies, we're going to do a lot of clapping today because we have a lot of dignitaries, so please bear with us. Thank you. Dr. Jamiu, please.
Thank you very much. Good morning, ladies and gentlemen. The representative of Governor of Lagos State, the Commissioner of Health, the amiable and infactible DG NCDC, whom I have the privilege of working with during the Ebola response in the country. I would like to send the greetings of the Honorable Minister of Health and the entire Ministry of Health for this very important occasion of looking at how we can strengthen the global health security in the country. This meeting is actually coming at a time when we are faced with a series of emerging and re-emerging diseases. As we are all aware, currently we are faced with multiple outbreaks, ranging from monkeypox, cholera, Lassa fever, and so on. So I think this is the right time actually for us to look back on what we are doing regarding surveillance in this country. And apart from that, the issue of antimicrobial resistance is another issue, which I believe it was presented during UNGAS. So I think this meeting is providing us a very good platform for us to have a review of how far we have done and to be able to fashion out the way forward. On behalf of the Honorable Minister of Health, I'd like to wish us a wonderful and fruitful deliberation in this 3 days meeting. Thank you very much.
Thank you very much, Dr. Jamiu Ganiu, the Chief Consultant Epidemiologist, Federal Ministry of Health, for those warm remarks. Moving on, it is now a privilege to recognize, but let me first confirm if we have the representative of Federal Ministry of Agriculture and Food Security in the room yet. Federal Ministry of Agriculture and Food Security. Can I please confirm? Okay. I know there are a lot of flight disruptions. Maybe they will join us shortly. Can I also confirm that we have Federal Ministry of Environment represented? Okay. Please come closer to the, you're meant to be at the, please come closer to the front. So please let's make welcome the representative of Federal Ministry of Environment to speak on behalf of this ministry. A round of applause for him as he makes his way, please.
Well, good morning, my distinguished senior colleagues and colleagues. I am someone who is not good at establishing protocol, but I thank God that the first commissioner. The commissioner did a good job, so I'm going to stand on his protocol. Thank you very much. I bring you greetings from my ministry. My director, Pollution Control and Environmental Health, Engineer B.H. Abubakar, sends our regards. We as a ministry are happy that the One Health platform has helped us to at least make some step and to be able to bridge the gap that has always been there. Thank God that we are no longer in the lacuna, but we are already making strides to also contribute our quota as a ministry. Environment is no longer what it used to be at the federal level, but we are grateful again that platforms like this help us to be able to at least showcase the little that we are doing and also how we've helped the country to move on. And having said this, I want to assure us that we are always available to continue working with us and with partners, and also contribute our own quota that the health security of the nation can be protected. With this, I'll say thank you for having our ministry, and we'll be grateful to learn from you and also send our report back to my seniors. Thank you so much for having us.
Thank you very much, the representative of the Federal Ministry of Environment. Moving on quickly to this agenda, it's now left for us to further reestablish the commitment we've received and enjoyed with our partners over the years. I'd like to start with the leading partner for surveillance in this country and globally, of course. It is now my pleasure to make welcome the WHR, World Health Organization, here himself. Ladies and gentlemen, a round of applause for Dr. Walter Kazadi Mulombo. I just like calling that name. Please give it up for the WHR, please.
Thank you. The representative of honorable ministers, Director General, NCDC, Honorable Commissioner for Health, Lagos State, a Special Advisor, the Governor on Health, colleagues, friends, partners, good morning. It's truly a pleasure for me to join you here and leave Abuja this time because Eko Onibaje. This is a center of excellence. It has always been, it will always be in the future, because this is where we take our inspiration from, whether to prepare for emergencies or to respond. It's an opportunity also for me to refocus a bit our attention on global health security agenda, which was born in 2014, several years after the international health regulations entered into force. And you all know that the IHR 2005 have been revised. There have been significant modification, which will be discussed during the platform. And the Coordinating Minister of Health tasked us, among other things, to reassess sport health services using the revised IHR. But talking about global health security, we know that the initiative was to prepare participating countries and parties to prevent outbreak. And that is through activity to fast-track antimicrobial resistance vigilance, zoonotic diseases, biosafety, and biosecurity. The second major objective was to build capacity that allow for early detection of high pathogen threats. And that addresses the national laboratory systems, which we will have time to discuss today, real-time surveillance, systematic reporting, and workforce development. I'm glad that this meeting is taking place after the training of DSNO and surveillance officer nationwide. And the last one address the capability of sectors to respond. And the emergency operation centers, the public health risk in our laws, enforcement, but also medical countermeasures. So now all these capabilities have evolved over time, but we learned the hard way when COVID-19 pandemic hit, when we realized that no country was ready whatsoever, irrespective of status of development. It's because of the lesson learned during the COVID-19 pandemic that at the regional level, a continental level, African Ministry of Health came together to endorse the regional strategy for health security. And that strategy built on the 10 proposals that the Director General put forth to strengthen global health architecture for emergency preparedness, prevention, response, and resilience. As you all know, the document has been endorsed by the World Health Assembly in May early this year. The framework reinforces core capabilities for prevention, preparedness, response, and resilience to health emergencies. There are indeed 5 interconnected capabilities, which we know as the 5 Cs. And the first one is understandably collaborative surveillance, which need to be strengthened through IDSR, but also increase capacity of laboratory to detect high-threat pathogen, but also perform genomic sequencing. And the other collaborative approaches for risk forecasting, for event detection and response, and monitoring. These capabilities need to work together with community protection, clinical care, and access to countermeasures. And the African strategy for health security emphasizes a number of goals. But I want to make a point here. I didn't realize you were projecting. I didn't mean to project it, but if you can just go to slide 11 and stop there. We are in an area of artificial intelligence that is also influencing global health security. To enhance disease surveillance, to build on predictive modeling and risk assessment, and inform personalized healthcare. Artificial intelligence has a role to play in global health security, and member states didn't realize that when they were designing global health security agenda. Artificial intelligence intervention are likely to have a role in pandemic preparedness because we can predict future course of pandemic or outbreak just by simulation scenarios, for instance. To enhance global surveillance system by integrating, analyzing data from diverse sources, and it can also play a role in vaccine development. As you know, that show in 2019, and building on progress of artificial intelligence, launched what we call the epidemic intelligence from global community of practice, also a range of multidisciplinary collaborators, and evolving fit-for-purpose system. So if you go to that slide 11, I'll just show you what it looks like and what is ahead of us as we talk about surveillance for better global health security. Next. Can you click on that link, please? Next. Slide 11. Yes. Click on that YouTube link. Do you have a volume? Can you have a sound?
Scientists are analysing samples from across the country in a race against...
Officials say that since late October, there have been 583 confirmed cases of microcephaly.
Scientists are analysing samples from across the country in a race against time.
South Africa Ebola outbreak has put 22 million people at risk.
Every year, there are significant threats to our safety, our health, our livelihoods. Dense urban populations and an increase in global travel and trade allow these threats and diseases to spread further and faster than ever before. And while best efforts are being made to respond quickly, it's often after an outbreak is well underway. But what if there was a way to minimize the impact on human lives and economies and to avert future crises? What if there was a unified, One Health, all hazards approach which would allow us to detect, assess, and respond to these threats sooner? EIOS, the Epidemic Intelligence from Open Sources initiative, brings together new and existing systems into a single, collaborative, web-based platform which screens through hundreds of thousands of open source reports and articles every day. It helps identify unexpected or unusual information, allowing cross-disciplinary experts to filter and focus on crucial content. Information can be shared across the network, allowing them to respond rapidly and effectively. Led by WHO, the EIOS initiative pushes innovation and technology to the forefront of future global health detection, preparedness, and response activities, while establishing best practices and standards for epidemic intelligence frameworks. By harnessing evolving technologies, the EIOS initiative also brings new opportunities for public health, such as applications for natural language processing and artificial intelligence, interactive detection and analysis, and real-time monitoring of stories as they unfold. Through collective efforts and with endless possibilities, this initiative stands apart as a unique, cutting-edge resource for saving lives around the world.
All right, thank you. So this is what we should expect as we talk about strengthening capacities for disease, for surveillance to improve health security. But there are, of course, challenges brought by artificial intelligence. Next slide, please. We have issue of data privacy and security, particularly when it comes to protecting individual data from patients. The development and the ability to use artificial intelligence is not even. We had other constraints, electricity, and other conditions. We have a risk of bias. Those who have more developed technology can have access to more data than developing nations and countries. Inequities in accessing application of artificial intelligence. And there are also issues of interoperability of different systems. This is one of the reasons why WHO has launched this open source program to enable member states to access information freely and hopefully use them for developing the surveillance program. So I just wanted to make this point to emphasize that we are in a different world and that artificial intelligence really has the potential to shape whatever we are doing to improve surveillance. It's obviously called for collaborative efforts for a safer world by working together to harness the full potential of artificial intelligence-driven intervention to create a safer world. We cannot rely on strategies of the past nowadays to improve surveillance for global health security. So let me come back now to the objectives of the regional strategy on health security. The first one, the aim is to contribute to the reduction in morbidity, mortality, disability, and socioeconomic disruption from disease outbreak and other health emergencies in our region. There are objectives to strengthen and sustain capacity to prepare for public health, strengthen public health surveillance and response system, ensure effective responses to health emergencies within 24 hours, but now we are informed by the 717 blueprint, ensure provision of quality essential services during emergencies, strengthening system and approaches of accountability, monitoring and evaluation, and promote strategic, synergistic, and mutually trusting partnership, which explain why we have a wide range of partners here. And the next slide, I would like to emphasize the target that each country, including Nigeria, have set. First one, to have 80% of districts in our country could coincide to LGAs that have capacity for response to high-threat pathogen. The detection of at least 5 sub-regional epidemic and pandemic intelligence hub that should be functional. Currently, we have 3, one in Dakar, one in Nairobi, another one in South Africa. But we have emphasized that Nigeria being 36 countries, 37 in fact, in one, we should be considered as a hub in our own right. We have a target of having 90% of countries mobilize effective response to graded emergency within 24 hours. I know we are still far from that target, but that's our aspiration. We are aiming at, to reach at least 80% of vaccination coverage using the reactive vaccination in response to outbreak. Something we achieve depending on some of the program, but we need to bring it nationwide. And of course, we need to have member states with reliable monitoring and evaluation and learning mechanisms as we learn from the outbreak response. And of course, put in place partnership for global health security. So I'll stop there. I will not go through the whole presentation, but I just want to make a final comment here. All this will work only if we have funding. And we know that the global community has established financial intermediary funds, which inform the pandemic fund to complement financing for global health security efforts in member states and countries. I know we've tried twice, but I'm sure the third time will be a good one. But it should also start with domestic financing. We need to make an effort that so that we can reprogram resources toward emergency preparedness and response and resilience. Other than that, if we don't do that, most likely we'll face the same consequences. Nigeria has shown an exemplary response during the West African Ebola outbreak. We have averted the doom under the COVID-19, but we are still being challenged by many, many other events, public health events, and we'll have more and more because of climate change and the microbial resistance and other threats. So I'd like to use this opportunity to really re-echo our call to Nigeria to really play the role it deserves in Africa and in the world. If it happens in Nigeria, it will happen everywhere. If it doesn't happen in Nigeria, it will stop everything everywhere. So it's with this word of this call, but also some word of encouragement that I'd like to thank you again for having us as part of this very major and big event. And I thank you for your attention.
Of course, the World Health Organization has been in the forefront over the years in the work we do, and they deserve all the time to walk us through the progress and the journey going forward. Again, thank you very much, the WR and the World Organization. Now that the WR has taken good time to give us that, I'd like to please appeal to the subsequent speakers to please speak as much as possible, but within a minute, so that we can allow our dignitaries to go to other engagements. For the goodwill messages, now I'd like to make welcome the representative of Africa Feed Epidemiology Network. Can I confirm Dr. Patrick is in the room? Okay, he was sitting there before. Please, let's put our hands together to welcome Dr. Patrick Ngoko for half a minute, please.
Okay. Thank you very much. Director General, Honorable Commissioner of Health, permit me to stand on existing protocol in the interest of time and really thank NCDC for this 5th annual disease surveillance review meeting. I would have hoped it's 13, but 5 is good enough given that it's annual. And really to thank everybody for this apt theme, strengthening global health security through improvement of disease surveillance. And just to say that for us to improve the global health security, as the WR has highlighted, we will need to strengthen state, country, but also LGA, but most important, individual health security for us to achieve the global health security agenda. And to reiterate that disease surveillance is really the backbone of disease control. And most important, I think surveillance, just like politics, is most effective when it's local and is a shared responsibility. And I'm really happy all the 36 states and FCT are represented. Unfortunately, surveillance, like respect, is only appreciated when it's absent. And therefore, sometimes it's difficult to make a business case for surveillance. But I really hope that in these 3 days, we shall push the effort of making surveillance everybody's business. And remember the core surveillance functions: the identification, the notification, the analysis, and the things sometimes that we forget in the era of artificial intelligence and the other technological efforts. I'm really happy WR has highlighted the 5 C's, and particularly the key role on collaborative surveillance. I do think that for us to achieve collaborative surveillance, I think the efforts on capacity have been very good, but the efforts on collaboration to truly achieve the collaborative surveillance indicators need to be doubled. So on behalf of AFINET, I really want to thank and congratulate NCDC for this 5th annual disease surveillance review meeting, and pledge our loyalty that we will continue with the workforce development that we've worked closely over the years, electronizing surveillance systems, but also the efforts on the congenital rubella syndrome and measles surveillance, as well as the epidemic ready PHC. So thank you very much, and I wish everybody fruitful deliberation. Thank you.
Being the flagship center for training of high-level epidemiologists across the continent, Affinet has done a lot, and yours sincerely is one of the products. Again, a round of applause for Dr. Patrick on behalf of Affinet for all you do. Apologies, it's important to let people know I'm an epidemiologist. Most times they think I'm just doing this MC job as a full-time. Moving on, we like to recognize and welcome on behalf of the United Kingdom Health Security Agency, UKHSA, no other one than Her Excellency, Dr. Shola Haruna, for the remarks. A good message on behalf of UKHSA. Dr. Haruna, please.
Thank you, Biodun. It's really a great pleasure to be in the state of aquatic splendor and the Center of Excellence. Honorable Commissioner, Professor Abayomi, and DG, Nigeria Center for Disease Control and Prevention, please permit me to stand on existing protocol. Thank you. I say again that it's really good to be here in Lagos. Every visit I make to Lagos is always an experience. I see some people smiling because they have something to give me back before I go from here. I think this 5th meeting is really key and is also apt. I've attended a couple of meetings in the past, and I'm really, really glad to be here and looking at the theme, excellent theme, in terms of how do we strengthen and improve surveillance. And in surveillance, I just want to take us back again to what we mean, which is an ongoing systematic collection, analysis, and interpretation of data, but not just for that, for itself, but to also inform decision-making. And I'm saying this because we've just, as UKHSA, supported the state disease surveillance notification officers over the past few days, and I really want to give them a shout out. Please give them a round of applause. Because again, surveillance is very local, and capacitating those at the local level to do what they do and do it even better is part of trying to improve our disease surveillance system. One of the things in the sub-themes of this meeting is learning lessons. And that's really, really key as well. We learn lessons for us to improve. And therefore, I would enjoy us all to look at the presentations of the days, the next couple of days, and hopefully pick up some lessons from that. Another point that struck me in the sub-themes of this is the issue of collaborative surveillance. And I was really, really glad to see our colleagues from the Federal Ministry of Environment speak to us. And I will commend you to listen to his talk. He's on this program around what the Federal Ministry of Environment also is doing. Because the way forward is how we collaborate in terms of surveillance. It's not just the human health alone, but also taking into account the One Health space, which includes the environment, animal sector, water, and all other stakeholders. So really glad that we're starting to move towards how we collaborate going forwards. Lastly, I think really glad, actually second to the last. So we have key folk here with us today, the state epidemiologists we've talked about, state disease surveillance notification officers, the laboratory focal points, and the health educators. Because even if we're doing surveillance, we also need to educate ourselves with the prevention aspect and the risk communication hat on. What then this means for us going forwards is that, it's because I'm not wearing my glasses, sorry for that, is to use the collective knowledge here today and hoping that we look at the recommendations from the last annual disease surveillance review meeting, see how well we've performed against those, because that's the whole essence of.
I'd like to ask of three things. Firstly, we need to continue to strengthen disease surveillance for Lassa fever. If we don't have the right data, we cannot do vaccine research, and we will not have a vaccine to protect us in future years. Secondly, you play a very important role. Please engage with the facilities in your states that are participating in several clinical trials for Lassa fever and preparing for others. Finally, I'd like to ask that you please advocate to the state leadership on the importance of this work that many colleagues like yourselves are doing. Thank you again for inviting us, and CEPI remains very committed to working with NCDC, with our partners at the state, and with several other international partners. Thank you.
Thank you very much, Ronke and CEPI, for all you do for the country and the world at large. As we bring to a close this round of goodwill message, it is my honor now to welcome the project director, Jepaigo, who will be speaking to us on behalf of this organization, the great work they've been doing, and the further commitment we look forward to. Please let's make welcome Dr. Yemisi Ogundare. A round of applause for Dr. Yemisi, please.
Good morning, everyone. And I'd like to also stand on the existing protocol today, and just to say how delighted we are as Jepaigo to be here today, to be sitting down with everyone that matters in the country as regards to disease surveillance. We're indeed grateful and we are delighted that we're here. And first, I'd like to congratulate the NCDC team, the Director General, and the Dr. Fatima and all the NCDC team for putting this together. I remember just a few months ago when we just started this conversation, and it seemed like an impossible task. But we're all seated here today. It just tells me that when we have a vision and we have support and we have networks, nothing is impossible for us. And, you know, this is, again, just gives me another excitement about the future that this meeting holds. Looking through the different sessions, there are outlined conversations around strengthening networks, around improving surveillance, around giving voice to subnational and empowering subnational, which is really like what, you know, someone had mentioned earlier today. Disease surveillance is local. So, I mean, giving the voice to everyone represented across the different aspects of Nigeria, it's really the future for us. It's really part of the excitement of why we're here. And I'm hopeful for all that the future holds for us in improving Nigeria's health security. I'm hopeful that as we engage and as we collaborate, as we network together, because not one entity can do this alone. I know, acknowledge all the partners here, and I'm quite hopeful that as we kickstart these conversations and continue to grow these conversations, I'm quite hopeful that there will be hope for Nigeria and there'll be hope for our systematic processes of collecting data. And I'm liking the conversations around introductions of AI now, because that's also the future. So I'm really hopeful about all the conversations that will come up in this 3 days. And I'd like to, again, on behalf of the Jepaigo team, congratulate NCDC and pledge our support again, and of course with that of our funders, CDC, although they are not yet here, but just to also acknowledge them and just to again pledge our support that we will continue to do our best to strengthen and support all the structures put in place, and to see that Nigeria continues to move forward as long as disease surveillance capacities is concerned. So thank you once again for having me, and wishing us a beautiful and a fantastic, productive 3 days. Thank you, Victor.
Thank you very much, Jepaigo, for the great job you do. Before I bring forward the Director General, Nigeria Center for Disease Control, for the opening remarks, it is now my pleasure, finally, on this section, finally, the representative of Resolve to Save Lives. The Executive Director is here with us, And it is my honor and privilege saving the best for the last as I make welcome Mrs. Nanlop. A round of applause for the ED as she makes her way to the microphones. I hope that clap can keep her coming. Thank you so very much, Mrs. Nanlop. Thank you. Resolve to save life is deliberate to keep the best for the last. Thank you.
Thank you, Beard. Just when I was thinking that I was going to be let off the hook without opening any remarks. But all protocols observed, the Director General, NCDC, and the Honorable Commissioner of Health, I stand on a already established protocol. So for Resolve to Save Lives, we've been talking about saving lives. So I think our name kind of encapsulates everything that we do. We do two different areas which are also interlinked, and disease surveillance is very critical to both. On our cardiovascular health work, we're also been partnering with the government. But our major focus for this gathering, which I'm really privileged to be part of, and I see it as an honor to be part of the fifth one. We count in, if you look at it, being, this is also my first, but it's also the fifth, and I think it's very important to have everybody in the room having this conversation. The annual disease surveillance review meeting, when it was first brought to my attention, I was wondering, what are we going to be talking about? Are we going to be looking at everything we've done in the past year? And how can we pull all of that together, the lessons learned, to move forward in setting the agenda for strengthening our health security systems? But it's so crucial to look at the collective. We talk about collaborative surveillance. We talk about working collectively or in a coordinated way. And I think at the heart of it is protecting the lives of all Nigerians, myself included, everybody here. So instead of looking all the time about just only the external factors, but looking also as each individual is impacted as COVID has shown us. So I'm hoping that in the next 3 days, looking at the agenda, which is very packed, there's going to be very important topics that we'll be discussing. Lagos is very central. We're convening here, but if anything happens in Lagos, if the systems in Lagos isn't strong, almost everybody, the whole country is affected, right? So I think it's two benefits of being here in Lagos. Not only to meet, but also to address the issues, because it's kind of like the window into the country, as is other ports of entry like Abuja or even Kano, where they're major, the population is also very high. From COVID-19 pandemic experience, even now we're talking about Mpox. I know we're doing work and we say, oh, the strain is not exactly hitting us. But these are indications, even for cholera, even in our own time, why do we have cholera? Surveillance is so critical to making all these decisions. My sister, Dr. Aruna, had mentioned about how important it is for us to strengthen our surveillance systems and how all of this feeds into developing even our national and our state action plan for health security. So it's my hope, and just bringing you greetings from our CEO, Dr. Tom Frieden, and on behalf of my team, some of them will be speaking on part of the panel, to welcome you on behalf of everybody else to Lagos as well. I think that apt sentence of Eko Nibaje is also apt for this. So Resolve is committed to supporting the government. We'll continue to work with NCDC and other partners together so we can build a safer and healthier future for our country. Thank you very much, and let's have a good deliberation.
Thank you very much, Mrs. Nanlop. The ED, on behalf of Resolve to Save Life, we are immensely grateful for all you do. Okay, so I've gotten another approval. You know, when the high table speaks, I take instructions. As directed, I'd like to make welcome the representative of the World Bank. Of course, it wasn't an omission. We're just trying to reshuffle the time. Please let's make welcome the representative of World Bank, Dr. Chijoke, who will be bringing forward the great messages and, of course, additional dollars for the work we do in this support. Let's give it up for Dr. Chijoke, please.
Good morning, everyone, and I'd like to stand on existing protocols. So I only came with a little wallet, so it doesn't have all of the monies. This is really true. Like each time I show up to see my mom, she actually tells me this, you know, you work in the World Bank. I say, yes. You have all the money in the world. I say, yes. I say, okay, sit down. So I bring just a little wallet, not all of the money in the world. It's really a pleasure to be here. And on behalf of my country director, Ndiame, I bring you greetings. The World Bank has been a partner to the government in the health security space for very critical endeavors that the government had laid out in the past years. During this meeting, we'll be discussing lessons from Redice and maybe sometimes lessons from the COVID operation COPREP. And all of this, the World Bank was privileged to be a partner with the government. I think we would not be amiss to restate most of what has already been stated, that any place that you have weakness in the whole chain, that's where the vulnerability lies. No place is safe until every place is safe. Part of what we have learned over the years is that with all of the effort going on at the sub-national level, states, LGAs, and frontline, that there is indeed a great need to shore up the frontline as much as we can, because sometimes that's where the vulnerability comes from. You may, or some may already be aware that there is currently an initiative of the federal government, which the World Bank is also partnering with the government on, that really does intend to build the capacity of the states, of course, led by NCDC. There are so many other conversations on how we can partner. So we continue to be available to partner with government and everyone here to make sure that this country is secure. It just takes one little strike, and all of the economic development that we are traditionally interested in, and all of the gains we make in human prosperity can become just suddenly very vulnerable. One last comment before I step down. I like the angle that the WR came when he started talking about innovations and AI. I'll just challenge all of us to think out of the box a bit. We can't continue to do things the way we used to do them. We have a term we call business unusual. Let's think outside the box. The traditional surveillance systems and framework, the way we used to think, are beginning to change. There are gains we can make through technology. There are other ways to approach the things that we do more efficiently. So I challenge all of us during this conversation to just step out a bit and think outside the box. What is it that we can do better? What is it that we can do differently? If we want to achieve the results we're all aiming to achieve, it can't just be business usual. It has to be some business unusual. Thank you.
I needed to allow the microphone to stay longer with you so that the money can actually come as fast as possible. Thank you, World Bank, for all you do and what we look forward to see. As the DG brings his remarks, let me again recognize all the great work all our partners have done. DG will do more to that. It's my pleasure to also especially recognize the great job of FHI 360. Thank you so much for all you do. I didn't mention that earlier on. A round of applause for them and all our great partners. Datafy, a long list. We'll come back to that later. So it's left for us. Please, let's be informed that as soon as DG is done with his opening remarks, there will be the official presentation of the assessment of air security capacities at the sub-national level, the Lagos Mission Report, that will be officially presented to Lagos State. Ladies and gentlemen, it's now my honor and privilege to receive to the microphone the one and only Director General, Nigeria Center for Disease Control, Dr. Jide Idris. Let's give it up for the DG as he makes his way to the microphone. Thank you, DG, for all you do. Thank you very much, Your Honor.
Please sit down. Thanks. I think we're all familiar with the protocol, so I don't need to go through again. I will only say that distinguished colleagues, esteemed partners, valued stakeholders, and cherished guests, ladies and gentlemen, there's a bit of a problem here, but this speech I amended it, but they printed the old one. We'll continue. I am deeply honored to welcome each of you to the 2024 Annual Disease Surveillance Review meeting. Our journey together, woven by the hard work and unwavering commitment of each of you here, embodies a shared vision. A vision for a healthier, more resilient Nigeria, where every citizen, from the bustling cities to the most remote communities, can live free from relentless threats of infectious diseases. We gather here today not merely as representatives of our institutions, but as stewards of a shared purpose, a purpose that is both profoundly challenging and immeasurably rewarding: the protection of every Nigerian life. Our journey today together has been marked by resilience, courage, and an unshakable commitment to safeguarding public health. This meeting at its heart is about the relentless pursuit of that mission, the one we carry forward both the weight of responsibility and the hope of lasting impact. Reflecting our achievements, our mission to protect Nigerians by preventing, detecting, and responding to health threats has demanded courage, resilience, and innovation. I stand here proud to reflect on how far we have come together. Over the years, we have faced and overcome some of the most formidable public health crises, from our rapid responses to Ebola and COVID-19 to our persistent battle against cholera, mpox, meningitis, and the newly emerging, often mysterious health threats, even like the suspected heavy metal poisoning we are now addressing. Each of these challenges has tested our strength, but has also allowed us to grow, deepen our expertise, and strengthen our resolve. Our nation's path has been one of trials met with determination, obstacles overcome through innovation, and threats neutralized by our collective will. Together, we have faced challenges that have tested our mettle and resilience. Each crisis, each outbreak, and each mysterious death threat has demanded the best of us, and each time we have risen to that call. This journey has not been ours alone. Behind every achievement is a vast network of partnerships, and I'm deeply grateful for the critical role that each of you plays. Your contributions are the bedrock of NCDC's achievements, from the dedication of disease surveillance officers who go out into the field to the expertise of our laboratory specialists, and from the insights of health promotion officers to the steadfast support of national and global partners. The recently concluded joint external evaluation, which reviewed 19 critical areas: surveillance, laboratory, coordination, and points of entry, amongst others, reflects the cumulative effect and dedication of everyone in this room. These achievements are not merely institutional victories, they are stories of collaboration, sacrifice, and hope. While the data speaks to our progress, the true measure of our success lies in the lives saved, the communities protected, and the hope restored that tell the real story of our success. But we must acknowledge our gaps and challenges and confront the complex realities. Yet in moments of accomplishment, we must also look with humility at the challenges that remain. We stand on the front lines against an array of threats, both familiar and new, predictable and unexpected. Today, we contend with an enduring cholera outbreak intensified by devastating floods across our states. The increasing data from these public health threats are not just statistics. They are stories of families, communities, and individuals whose lives hang in the balance. The public health crisis has not only underscored our vulnerabilities, but has exposed our gaps in resources, data systems, and human capacities. Our health security structures, like the invaluable team members stationed at the state, the local government, and community levels, remain our backbone. Yet, changes in administration, shifting resources, and the push and pull factors have thinned these ranks, leaving us vulnerable and stretched in critical areas. Delays in data transmission and reporting, inconsistencies in data quality, and prolonged laboratory turnaround times hinder our ability to act swiftly and decisively. These challenges, while significant, do not weaken our resolve. Rather, they serve as a call to action, a reminder of the work that remains urgent and essential. What is the purpose of our meeting, our collective mission today? Global health security, as we know, is not an abstract concept. It is a daily commitment to ensuring that each and every community in Nigeria is protected and prepared. It is a realization that by fortifying our local systems, we contribute to a safer world. We must think globally and act locally, identifying and addressing health threats before they escalate and spread. And like I've recently said, we talk about fake public health emergency of international concern. I think to get it better, let us consider public health of national concern, public health emergencies of a national concern. If you can do that, fake will not be necessary. The theme of this year's gathering, strengthening global health security through enhanced surveillance, is both a challenge and an opportunity. It calls on us to recognize that health security cannot be achieved in isolation. True security for Nigeria and for the world begins at the grassroots, in our towns and villages, in each neighborhood and community. Every case prevented, every life saved at the local level strengthens the health security of our entire nation and indeed the world. Our discussions over the next few days must be bold, innovative, and focused. We will assess our surveillance structures, evaluate laboratory and diagnostic capacities, and reimagine how we engage with communities as partners in this mission. Yet, to meet the demands of a shifting global landscape, we must also adapt. Like Chijoke said, let's think out of the box. New technologies such as the electronic IDSR, epidemic intelligence systems, and advanced diagnostic tools are no longer mere options. They are necessities. As pathogens evolve, so must our responses. We are called to think not only as health professionals, but as pioneers, ensuring that our nation's health defenses are equipped for the future. Our discussions must go beyond our current models. We're in a race against time and complexity, where pathogens evolve and boundaries blur. We must evolve our methods, not only to keep pace with these threats, but to stay ahead of them. I urge you to bring your full commitment, your innovative spirit, and your passion to these discussions. Let us examine our data with rigor, reflect on our successes and setbacks, and chart a path forward that leaves no Nigeria behind. Each of us carries a unique piece of this puzzle, and only together can we build the resilient, responsive health system our nation needs. Our surveillance system, our policies, and our public health interventions must be driven by high-quality, actionable data, ensuring that we remain responsive and resilient in the face of potential outbreaks. It is also an opportunity to remember that we are part of something much larger, a network of global protectors. As we strengthen our systems here at home, we contribute to the global fight against infectious diseases, creating ripples that extend well beyond our borders. In this room are some of the brightest minds and most dedicated souls in Nigerian public health space. I believe that what we accomplish here will echo beyond these walls through our communities and across generations. As we deliberate on policies and strategies, let us be guided by the principle that health security is not an abstract goal, but a tangible, urgent mission that affects real lives, real families, and real futures. The road ahead will be demanding, but it's a path we are privileged to walk together. We have seen progress that once seemed impossible and overcome obstacles that would have deterred the faint-hearted. Our work is as complex as the threats we face. Our past achievements and shared commitments are a testament to our ability to adapt, innovate, and remain steadfast, even in the most trying circumstances. We are called to build on this foundation, to elevate the standards, raise the bar of disease surveillance and response, and to ensure that every Nigerian community stands resilient against health threats. Our challenges are complex, but they are not insurmountable. We have proven that time and time again. However, as we look forward, let us not rest on past victories, but instead build upon them with renewed energy, knowing that the health of millions depends on special appreciation to you all for the sacrifices you make, for the courage you bring, and for the hope you inspire. This work, this mission is not merely a duty, it is a legacy. Together, let us forge a future where every Nigerian, regardless of where they live or their circumstances, is protected, empowered, and secure in the face of health challenges. As I look forward to fruitful discussions, ambitious strategies, and untimely, and ultimately, a stronger health security system that can protect Nigeria today and for the generations to come. It is my deepest hope that our time together here will inspire us all, renew our collective spirit, and result in actionable strategies that will transform our public health system and leave a lasting impact on our nation. Esteemed colleagues, I thank you for your attention. Where is it? So just to there's a formal presentation of one of the reports here today. This is for Lagos State. The Lagos Mission, the assessment of the health security capacity of the state at the sub-national level for Lagos State. I think this was done between the 13th and 17th of May, 2024. Like the commissioner said, he's not bothered about the score. I mean, the low score. I also remember that, NCDC first result was in 2017, when Nigeria scored 34%. But a couple of years after, the score was raised to 54%. And for NCDC, our target again now should be 70%. So, may I call on the Commissioner for Health Lagos State to please, the Lagos team, with the Commissioner and the Special Advisor, to please, as a token presentation of this report, please come.
The Lagos State team to support the Commissioner.
It's interesting. This is a go for show.
This is Lagos.
Honorary Commissioner for Health, Special Advisor. Like I said, this is just the first subnational assessment. You'll be, I think, the fourth or the fifth state that has gone through this report. This is just a charge for us all to do better. You can't know how you're doing if you don't know what the baseline is. So I congratulate you, and I hope that next time we do this exercise, not 100 or not, much better than this. Congratulations. Yeah.
Yes, commissioners.
DG, and all the members of your organization, NCDC, I think this is part of a global initiative to raise awareness and to understand the principles of the international health regulations, of which the JEE is an assessment tool. You can't know where you are until you are subject to audit and assessment. And this, for us, is an incredibly important document. And we've actually been waiting for this for a long time to help us to know where we are, not to rest on our laurels, not to think that we did well during Ebola and COVID. As far as we're concerned, we tried our best, but the WHO tell us that there are more shocks on the way. And therefore, this document is now going to become the Bible by which we will use to assess all the areas that were examined. And I've been reading the report since I've been sitting there, and it is very thorough. It is very detailed. Your team has done an excellent job, and we thank you for that. We didn't, if 50% is the pass mark, we didn't pass. But Lagos will never take last. And it is from this point that you know where your baseline is, as you said, DG. So we're looking forward to going through, working together, putting a special team to understand what we need to do and to promise you that the next time you come, we would have put things in place that will make sure the scorecard improves. So I'm going to present this to His Excellency. We're going to have a presentation to the Executive Council, to the relevant commissioners, commissioners of environment, commissioners of agriculture, the Attorney General, and the Ministry of Economic Planning and Budget, because there's a lot of conversation about appropriate budgeting inside this document. And I think it's important that the Executive Council and my colleagues know that we can only be as strong as the resources and the expertise that are allocated to us under these circumstances. On behalf of Ministry of Health, our entire team here, thank you very much, and we appreciate you.
This is a call for action.
Congratulations, Lagos State. Another round of applause as the powerful Lagos State team. You can go with it. It's your copy. Congratulations, Lagos State. We are confident that by the next JEE for Lagos State, I'm sure it will be 85%. Yeah, we're very ambitious. Thank you, powerful Lagos State team. I can cite the longest serving state epidemiologist in Nigeria. Do I need to mention the name? We appreciate Dr. Ismail Abdul Salam for all the great job he did on this. The entire state team, the Ministry of Health, Agriculture. But I must also recognize the national lead on this assessment. the national lead on this assessment from NCDC, Dr. Oyelado Kuromade. Thank you so much for the excellent job done. And for everyone, thank you so much. So, moving on, what's the next thing? I think we're done. We have not had the objective, so I know. Let's be sure that we are together in this. Is it group photograph? We still have to take the objective before the group photograph. Please bear with us. Let's quickly take the, thank you. By the way, Dr. Rabi Usman is co-anchor in this meeting, but she has abandoned the ship with me. So let's make welcome the one and only Director of Epidemiology and Surveillance of the Nigeria Center for Disease Control, in no other name than Dr. Fatima Saleh. Round of applause for her as she brings forward the objectives for this meeting, Your Excellency.
Please, Secretariat, can you quickly project? Yeah. Okay, so thank you so very much. Kindly permit me to stand on the already established protocol. But, I crave your indulgence to acknowledge my boss, Dr. Jide Idris, the systems and the team-based leader. Thank you, sir, for your leadership. Of course, the Honorable Commissioner of Health, the SA, Lagos State Government, the WR, the Chief Consultant Epidemiologist representing the Federal Ministry of Health and Social Welfare, specifically the Director of Public Health, my state teams, of course, from the onset, this has always been a technical meeting, but we can see that we are getting a mix of policy and other strategic components aside the technical aspects of the review meeting. So I want to recognize the state epidemiologists, state DSNOs, state lab focal persons, the state health educators, of course, my esteemed colleagues, the NCDC directors, or the senior directors and other heads of department within the NCDC, and the representative of the professional bodies, because we could see part of the agenda going forward is to scale and expand to health facilities. And in no particular order, we acknowledge, for me specifically, the Nigeria Medical and Dental Council, the Nursing and Midwifery Council, the Community Health, and other professional bodies here. The press, ladies and gentlemen, and the Secretariat, my great team, my wonderful team. I want to acknowledge you even before I start this aims and objective. That's my task. Thank you, sir. DG, permit me to forge ahead. So the annual surveillance review meeting is an annual event where the NCDC hosts a network of state epidemiologists and other frontline workers. We've mentioned health educators.
Of Medical and Dental Council of Nigeria, Nursing and Midwifery Council of Nigeria, and Community Health Practitioners Registration Board of Nigeria, all here represented. I'm just doing that to get this set so that we can all come forward. So now we are set. Please, may I kindly request the members of the high table, DG, the Commissioner, Governor's Representative, WR, please, all the high table, please let's come forward. Representative of Ministries of Health, Ministry of Environment, Ministry of Agriculture, please let's be seated. Then the Director of Surveillance, of course, you are the co-convener. No, the SA sits, okay. Ministry of Health, okay. Okay, so now let's have the partners representative, one partner representative, and let's have the state epidemiologists. Please join us. I say you can have your seat. Are we fine? The directors, please. We have called directors first. Directors, please, the first row here is for the directors. The first row behind the commissioner. Okay, sorry. NCDC directors have been called to that correction. NCDC director, of course. Dr. Abdulsalam, you can stay there. You are a director now. The host director. FCT, apologies. You are part of 36 state now. Yes. Please, let's come forward and join the group photograph. Partners representative, directors, state epidemiologists. Okay, so please hold on if you are done with this. Please hold on. Okay, thank you very much, everyone. Thank you, thank you. So as we formally close, the DG will lead the dignitaries to exit the hall so that they can have their refreshment. So we're officially breaking for tea, and we're expected back in the hall by 12:15. 12:15 is the time to formally reconvene in the hall. Please, let's be reminded. Thank you very much, everyone. And thank you for all you do, from Ibadan to Enugu to Kano, Abuja, and now we are here in Lagos for the 5th EDRSM. Thank you so much, and congratulations to us. Please don't leave your belongings. Please don't leave your belongings. So what did I call here? Do you know what that I called like 3 times? How many times do you give? Okay, no, we didn't call it. We didn't call FAO, we didn't call UNICEF, we didn't call many people. Well, then there'll still be opportunity. Oh. I mentioned IHL. Then not everybody will be able to call forward for I mentioned this, I mentioned it again, and when I now like you are, I don't. I call this list. I call this list in the beginning, and one day I call it again. But not for, yeah, I understand that. All right. Of course, you are doing great work. It's just that what is asked me to just do because of the time. Down